Good afternoon, everyone. Thank you all for coming, and of course, hearty welcome to Quesnel-Vallée. We are delighted to have you here, and we're looking forward to this wonderfully named talk. I look forward to the data wonderland that promises to be quite interesting. So Amélie Quesnel-Vallée is a Canada Research Chair on Policies and Health Inequalities at McGill. It's a joint position in Sociology, in Faculty of Arts, and under Faculty of Medicine, Biostat, Epidemiology, Biostats, and Occupational Health departments. And Amélie is also the founding director of IRIS, which is the International Research Institute on Social Inequalities and Health.
Yes.
And a founding member of the Center for Population Dynamics at McGill. Amélie's multiple backgrounds comprise sociology, social epidemiology, as well as demography, and her research interests are comparably varied and reach into the areas of health inequalities, healthcare and health services research, and social policy more broadly. And correspondingly, her work has been published in many high-impact journals, including Social Science and Medicine, International Journal of Epidemiology, or the Canadian Medical Association Journal. She has consulted broadly, including for Health Canada and Statistics Canada, where she's been serving on the National Statistics Council for a good 4 years, since 2014 or so.
Well, it's over now, but yes, the council is over.
Amélie was awarded numerous major research grants, totaling over $3 million for her research, including her work to understand how social policies contribute to health inequalities over the life course of Canadians. And the talk today is, I think, part of that broad line of inquiry. And so we'll learn how income, including government transfers, over 20 years of respondents' lifespans influence their health and disability. So again, welcome.
Thank you. Well, thank you for the warm welcome, and it's not just heat if I'm a little red now. Just a generous introduction, and you totally set the stage for this talk, so I'll probably just dig in really quickly, just to let you know why I added this subtitle, switched the subtitle a little bit, is because I want to show you those results on those income histories, I'll call them. They're not yet trajectories, quite, though there are some latent class analyses in there, and their association with health and disability in adulthood. But also, I want to kind of overlay a kind of meta commentary on what it means to be working with administrative data in the current Canadian landscape, which, as you may know, is going to become ever more prevalent as Statistics Canada is moving now to focus more on admin data as a primary source of information, complemented by survey data. And so I'll just kind of walk you through my own adventures in administrative data wonderland, and how I went from, oh my God, wow, this is the candy store, to, okay, let's take a pause and think about what this really means. So just to broadly situate my research on health, it's in health inequalities, social inequalities in health, and here I do some research on mortality, but I'm not going to present it in this talk. Sorry, back. I went a little too fast there. Okay, and what I do want to show is that those health inequalities are really pervasive. They go as far down as the root of life expectancy at birth, and here you see the range of life expectancies. So Canada is at the top, with Sierra Leone being at the bottom, wide-ranging inequalities, but also within our own country, between Indigenous people and the Canadian average, so we see those stark differences as well. And by all accounts, these differences cannot be attributed to genetic differences. They cannot be attributed to just health behaviors and so on. We have to look deeper at the structural determinants of health, the social structural determinants of health, and this is what led the Social Commission, the World Health Organization Commission on Social Determinants of Health, to state very starkly that inequities are killing people on a grand scale. So that's my kind of starting point. And then as far as a little bit more concretely, there are as many pictorials of the social determinants of health framework as there are researchers almost. I particularly like this one because it sets individual populations at the center with those factors that are probably not so much influenced by policy at this point. When CRISPR gets better, maybe we'll get into the genetic factors, and let's see for those health inequalities when that happens. But aside from that, I like that it shows how these are embedded in interactive layers, and so we can really radiate out to those policies. My research focuses more at the outer realm of those layers, so looking within countries at things like healthcare services. I'm not going to talk about this too much today, or not at all today, rather. And then what I want to talk about today is those living and working conditions, and especially unemployment, and how policies and programs related to unemployment and workers and income support play out in the Lifecourse. And then at the broader context here, the general socioeconomic, cultural, and environmental conditions, this is where you would start looking at comparisons between countries or interactions, or rather time variation within one country. So you have to start varying the policy environment on individuals at that point. So that's it for the social determinants of health. Sorry. The other element that I bring in, or the other conceptual element that I bring into my research, has to do with socioeconomic position over the Lifecourse. So taking a stratification perspective, especially in over the Lifecourse. So in some of my research, I focus on parents' socioeconomic position, namely education particularly, how that has an association with offspring's education, and then looking at how income, not so much social class and social status here, but really focusing in on income is shaped over the Lifecourse. So thinking as much as possible in terms of trajectories, in terms of movements over time, and how that relates to Lifecourse and health. Here, I'll put those all in there. So drawing from Lifecourse ideological models in epidemiology, we can kind of tease out various models in thinking about how social factors, here we'll take those to be social factors for our purposes, but also in this conceptual model, largely, have an impact on health later in life. And so here you can see, for instance, the critical or sensitive period effect suggests that when things happen at a particularly important developmental time in people's life, they will have an effect regardless of what happens after. So you have A that happens at a developmental window that has a strong impact later in life, regardless of B and C, and with not necessarily with an association with B and C, which we see later in the pathway effect. In the critical period, in the critical perspective, this has to be a primarily fundamentally biological process. And generally it tends to be very strongly limited to very biological windows where when things happen, there is no going back. So that's a very specific kind of model, most commonly associated with cardiovascular disease, things that happen in utero, not the kind of things that I'm going to talk about today, though I do have some research that looks at the developmental origins of disease and health, which has some linkages to that. Cumulative effects, we're going to talk about that a little bit today, so this is pretty self-explanatory, I think. So you get, the more of it you get, regardless of when it happens, the worse. Pathway effects, I think, are the most interesting, certainly from a sociological perspective. So this is the idea that you have chains of risk. And these are not, of course, deterministic chains of risk, they're probabilistic chains of risk. And they can involve knock-on, knock-off effects, and also direct effects of each of those elements. The ultimate idea is to get to that. At this point, I'm going to show you kind of descriptive associations that are on the pathway to getting to something model, or more of a model like this, taking unemployment and later health as kind of the anchor of those stories, which segues nicely into what I'm going to talk about today. So we know that there's an association between unemployment and health, and here I'm leaving it two-headed arrow voluntarily, because whether this association is actually moving from unemployment to health directly is not as evident from the literature. I think there's a lot of speculation and certainly hypotheses that it can work both ways, but the extent to which the components of this association is due to one direction or the other is not as clearly delineated. I'm drawing from some recent research by Silas and Avendano, and Silas Gilmore and Avendano in using US data in support of this question. One of the clearly hypothesized pathways is that if there is such a relationship, causal relationship between unemployment and health, it must go partly through income loss. And here I'm isolating income loss because it's what we have, it's what I want to look at. But of course, we would want a fulsome picture, would look at other type of more psychosocial effects, isolation from the labor force, stress, and so on. But just focusing on income loss, which certainly is likely to be a big one, and also is one that is related to one of our big insurance programs, income insurance program, which is employment insurance. So the idea, if we look at this kind of pathway model, is that unemployment happens in some places more than other, and I'm going to suggest to some people more than other, and that's our big problem. And the extent to which those people are different, systematically different, on things that are related to health or that are health themselves is going to introduce some heterogeneity in our estimate. And so the extent to which we can truly estimate this effect of employment insurance, this mitigating effect of employment insurance, might be conditional on whether we actually can take out the risk or this heterogeneity on unemployment. So to put it differently, we have the suspicion that there are some people in the population for whom unemployment is a truly exogenous factor. It's a shock, it happens, and there have been studies looking at job loss that can be for individual responsibility. But what about looking really in this pathway of health, and then ultimately also poor job conditions? So my final kind of model a couple of years from now, I want to be looking at how health may actually be a precursor of either poor job conditions leading into higher risk of unemployment and then later health, and conversely, how poor job conditions, to what extent is the relationship that we're seeing here is due to poor job conditions leading to poor health, leading to potentially to unemployment and to health. Right now, I'm going to focus more on this relationship and show you how I'm gaining, I hope to convince you, some traction into the story behind here, but more from an indirect pathway or indirect identification framework rather than a direct observation. And I'm going to tell you why that is in a minute. So, that doesn't show up very well. Anyway, in order to look at it in a little bit more systematic way, we conducted a systematic lit review of income, benefits, and health. And here we have both well-being, general well-being, and disability in the systematic lit review. And I wanted to focus more specifically on income benefits. And here, this is delving into like the specific, the specifics of the study. So focusing in on administrative income data. So there are studies out there looking, meta-analyses looking at unemployment and health, unemployment and mortality, and showing that they have relationships. But oftentimes these studies are looking at the experience of unemployment and mortality risk later on. They don't necessarily look at income supplementation. They don't necessarily look at income or health prior. And so I thought, well, let's take a look. We have these new data. So that was the underlying kind of idea. We have these new data coming to Canada with income admin data. What is known elsewhere about income admin data and health? And so you see we got fairly large initial count. And through the various elimination procedures, so the systematic lit review process is, as it says, a very systematic assessment of the literature that is conducted by 2 independent readers going through all of these screening processes. And we are now at the full text review of those 79 papers, which for those of you in EPI, you know, it's a fairly large corpus of information. We're not heading towards a meta-analysis because we think that there's going to be too much heterogeneity. So this is what we can try. We did it with a social support and depression a question, which was quite a handful. So it's possible, but I think it might be a little too ambitious. Anyway, all that to say, I don't have the results yet of the full text review, but I do have some inklings. I have looked at it, and so I have some initial findings that I can share with you. You won't be surprised to know, so again, income administrative data. Guess where most of the studies are coming from? Scandinavia. Yeah, just going to Anders. Yes, some from Anders and some, most of them from Scandinavia. The other thing to take away is that when we look, so in those income benefits, we're looking specifically at unemployment, disability, and social assistance. Most of the studies look at either one of them. They don't like at them in separate silos, if you will. Not necessarily in interaction or in association with each other, and that's exactly what I'm going to try and do today. I suspect, and maybe you can confirm, that that may have to do with how the data files are being constructed or where they're coming from if they're not being linked across. So anyway, so that's something to take that we have the opportunity of doing in Canada that I think can give us some insight as to what's going on. The other thing, of course, is that when you're looking in the admin database, very few studies are measuring health prior to unemployment. These are not survey-linked databases, and so there is a fair amount of unobserved heterogeneity that goes on. And what I'm going to try and argue today is that when we look at a history of different income benefits, so whether people got only unemployment, nothing, no income benefits ever, only unemployment, only social assistance, only disability, and then combinations of those, I will argue that we can actually get a little bit of a handle on how things are playing with each other, and a little bit of that heterogeneity can be unpacked. So disability does capture some health dimensions. I'm already going to disclose to you that in Canada, it is health, but it's also what I'll call advantaged health. So people, we know that the take-up, there's a take-up issue with disability benefits, namely a lot of people, and this is my first message with regards to admin data, you only observe people who have claimed the benefits, qualified for the benefits, or gotten them. So right there we have some unobserved heterogeneity that is going on. So but it's interesting, and once we get that link to survey data, we can start and see the extent to which, and this is starting to happen in Ontario notably, at the Institute for Clinical Evaluative Sciences, so the extent to which there is unmet take-up. And so we have that first element, and in my analysis I would say that disability, so this is the receipt of disability payments and also a receipt of claiming a disability subsidy. It seems to be coming to some groups more than others, and it doesn't seem to be as associated with long-term poor health than other elements. Or it's more advantaged from a socioeconomic standpoint also. Welfare receipt, of course, captures low income, which is a health determinant, as well as a potential benefit substitution. Again, another topic that hasn't been as exploited in Canada. So when do people fall off of unemployment eligibility and start having to claim social assistance? So those are some of the things that we can start looking at. So my question that I'm going to explore empirically in the next couple of slides is, what can we learn about this unmeasured heterogeneity among unemployment recipients by taking into account receipt of other benefits? And I'm going to walk you through that. So how do we study that? Well, the problem in Canada is that our health studies rarely measure income well. Our income studies rarely measure health at all. And so we kind of have, we do have a wealth of data and a wealth of underutilized data. Ask any StatCan person and they'll tell you, well, our surveys, they do the most they can, but they're underutilized in relative terms. So the solution, question mark, linkage to admin income data. And that's what I thought at first. And so the first time I became aware of these opportunities, full disclosure, I did consult on the precursor to the LISA, consulted on the LISA as well. So, but I'm not responsible for the decisions that were made. But I did feel like this was the candy store, right? After leaving the US and having this wealth of data completely openly available, working with in the KICs or in the RDCs rather, that's fine, can deal with that. But then having something like the NPHS, first of all, terminated, thank you, and then having it have these measures of income that are just like categorical, and you say, really? That's all we have? We can make do, right? There are other ideas, but then when this idea of linking everything to everything, really, which is what StatCan is doing right now, linking admin data to pretty much everything that moves, it does feel like, this is it. We're it. And and they're rolling it out in the RDCs, right? So it's for everybody to have. It's no longer this super initiate thing where you have to know someone in order to get in. So there is some of that, and I still have some of that. But then there was also some pause in actually digging into the data. So here I'm going to be using the longitudinal international study of adults, which I'll present the structure this way. So in orange are the admin data that I use that are linked up, and there's far more than that's being rolled out. So there is also, in addition to this, there is also pension. There's also the immigrant database that's being the lending database IMDb that's being linked, and again, whatever is possible. The mortality records are also predicted. They expect to link them respectively. So we have these admin data. I'm using the T1FF file, which actually runs all the way back to 1982 to the present, and the linkage is currently performed and it's currently available in the RDCs. If you do request the LISA, do make sure that you request LISA plus admin. You have to ask for it. And so otherwise you'll just get the LISA and then you'll be another 2 weeks in requesting the admin data. Just little tips, happened to me. And I'm like, why would you not want the LISA, the admin data, right? And then they come in separate files, but that's a matter for later. Then you have, so although the data go all the way back to 1982, I only start using the data from 1993 for the T1FF file. The reason being, there was a big change. This is the message number 2, unobserved. Again, not everybody files a tax record. And so if they don't, they're not in your data. And prior to 1993, people with no or low income had very little incentive to actually file a tax record. Starting in 1993, the reform of the tax code, They actually, in order to qualify for income benefits, certain low-income benefits, you had to file a tax file. So the coverage of low-income people gets much better. I'm interested in inequalities, social inequalities. If you're interested in social inequalities, be very careful about using data that predates 1993. Validate. Yes?
Amélie, what share of the population do you think is not filing taxes
Now?
and therefore are not in your administrative
Now
files
it's,
for
my
1993?
sense is it's very low, especially if you're doing averages, every 5-year averages, which I would recommend with that much data anyway. Your many models won't fit very well. If you try to do a year to year, I don't have the numbers off the top of my head, but it's there. It's an undercount for sure, and it's not a random undercount. It's going to be more tailored, more weighed towards the low income, which in some sense you might say, well, this is going to make my results more conservative. I'm undercounting low income people, but I feel that's like our cop out, and I am going to use it in some, still in some of my analyses. But yeah, that's the element. We'd have to go to the ESVC, to Revenue Canada, to have really a sense of what their sense of the undercount is. So that's for the admin data here in the dotted line. And then we look at the biennial survey data. So right now NDRDCs are 2012 and 2014 available. 2016 obviously has been collected. We're in 2018, should be happening soon. We get that third wave of data. So the LISA is actually a fairly large sample in the 30,000s of individuals in 16,000 households. So it's a household-based sample. So you can do analyses at those levels. It was meant to be fairly small at the beginning in terms of survey collection. So what they did is they rolled out modules as they go along. So at first we have very bare health information, only self-assessed health in 2012. And then in 2014, disability, big disability module rolls out. So we do have a lot of that information. And I use these other control variables here as well. And then there's going to be other modules rolling out in 2016. And another feature that might be of interest to some of you doing social ed research, sociology of education research, 2012 was actually overlaid with the PIAC sample. So there's an education assessment, literacy assessment for some of the LISA members going forward. So you can actually start with a really nice literacy assessment. So the study design, I will study the association between up to 20 years of historical income tax records from the different sources. So the family income trajectories, which we have classified in classes, income from employment insurance, welfare, and the disability credit and receipt. And I'm focusing on, so this you have here, this is a SHRC grant, so you have the language of the well-being, but really it's self-rated health and disability. This was before SHRC came back into funding health. So now I'm outed. We could still study, in demography, you could still study mortality, so that was okay. Yes?
What is the difference between employment insurance and welfare? Is employment insurance for short term when you lose your job, and then welfare is for low income?
Employment insurance is for workers, and you have to have qualified for it. Right. Social welfare is the safety net, the social safety net.
Are there different levels? It's higher for EI than for welfare?
Mm-hmm. The replacement is higher for EI. Okay. Yeah, replacement salary, and it's it's very complicated in Canada. So there is no one, I can't tell you what your EI replacement would be. Right. It's dependent on where you live and the level of unemployment in your jurisdiction. Right. So it's, and of course what you contributed. So I'm pretty sure you got max contribution, but what it would be here, I don't know. Yeah. But definitely social welfare is very low, and it's in a welfare perspective that is not, they don't want it to be a disincentive to work, right? So in Quebec, it's about maybe, now I think it's $570 per month. So low. Yeah. Yeah, so it's really, it's the like full bottom safety net. You were saying here in Ontario, what is
I think
it?
it's like $630 or $650 for a single person.
Yeah, so it's very low. And I conduct all my analyses stratified by sex, though I will tell you, and you will see that the results are really, so there are differences descriptively, but not very different by when we get into the multivariate models, which is often the case, actually. So, TIF, what is the TIF? It is not the LAD. So if you've heard of the LAD, it is not the LAD. The LAD is a longitudinal admin database. It is maintained by the income analysis people at StatCan, and it is lovingly maintained. It is, and now they're like letting it out and sharing it with the public a little bit, but it is much more, it's a much cleaner data than the TIF. The TIF is the raw, pretty raw database of the income administration. So essentially the Revenue Agency of Canada collects your taxes and also collects information on you, and then is sharing it with Statistics Canada, and all of that is legal, of course, and all confidential. And so all the anonymized data. And what else did I want to say about that? Yes, so one thing to remember or to think about if you want to tackle the TIF files with the LISA or any other survey really, is that programs change over time. And so when they capture certain information, the names of the variables that you're looking at may actually change over time. So the third point in this like meta commentary on using admin data, know your social programs. And know what you're looking at. There are, so some of them are awesome changes because you can use them as natural experiments. Others are just going to be pesky thing in your data where you think you're looking at something and then it changes. So keep that in mind. So fortunately you see the data, variables changing over time, but you may have to do some digging up to make sure what it is. So I use the historical income tax records from 1993 really onward. First thing, family income. So your definition of family may not be Statistics Canada's or the Revenue Agency of Canada family. So in this case, family is people in the same household. The best we can do. So this is admin data. I can retrace, going back to the TIF files, who is in the household, but at this point I'm just going to take it as is. We know it's not a huge assumption in Canada to think that those adult earners that are in the household are going to be together-ish. And so
what happens if they don't? If they split up?
Well, if they split up, they go away in different tax file. They don't stay in the family income. So I lose them. So my family income changes for the unit of that individual. What I mean is, what if there's a child earner? What if you have your 25-year-old who's still living at home? They're going to be counted as an additional income. So I'm going to live for now with that fuzziness, which I don't think is going to be too much of an issue. Social assistance. Disability, and here it's the social assistance, social welfare. I move between the two because from, I think, general parlance, we're more used to talking about social welfare, but the technical term is social assistance. Disability, income and tax credit, and employment insurance. And here, note, not unemployment insurance, so the current term is employment insurance. So, yes?
Just to return to family income, would that include roommates?
Well, that's the other fuzziness, right? So if your 40 to 64-year-old has a roommate, which is my sample, then yes, it will include roommates.
Okay.
Yeah.
So you should know from the tax data whether people are reporting the other person in the household as the common law
Yes,
partner
I'm
or spouse.
saying I just didn't go into that level
Okay.
of detail.
Okay.
Yeah, because I'm dealing with 20 years,
Yeah.
and so it's another 20 years of coding
Yeah.
that I have to demean, and I'm going to tell you about some of the demeaning already, or some of the cleaning up that we're doing. So you would think, these are like the variables, and these are fairly straightforward variables. I have my variable E-ins, so I'm picking that up and I'm thinking, well, yeah, good, ready to go, right? Run the analyses. No, because in employment insurance benefits in E-ins, we don't just have the temporary benefit for workers who lost their job or are out of work. We also have, boom, 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 parental insurance. So that also kicks in through employment insurance. So whenever you study employment insurance, you have to think about that. It also includes sickness. So at this point, I'm going to leave sickness in. So this is where I was hinting that I was going to get also, again, more conservative results. I don't know at this point how, well, you'll see my analysis and maybe you have some suggestions. So already I'm going to be looking at people who eventually get employment insurance and disability, employment insurance and social welfare. So I think the sickness part, is going to show up in those groups. That's my assessment. The parental insurance part I'm worried about because I don't want to count or wrongly count people. What I want to get to is whether people are losing their job or not.
Right.
Not whether they're choosing to step out of their job to have a child.
So you can measure that if it's linked to the employer data through the ROE data, the record of employment.
Mhm.
For
Well, we
most
have the
people-
T4.
Yeah.
Yeah, so we can do the T4, but there's as many T4s, lines, as there are employers.
Right.
So that linkage, yeah,
Okay.
I looked into
Okay.
it, but that's another massive back linkage
Yeah.
that we have to do. So already, I had an analyst for a brief period, and she looked into it, and she's like, I don't know how to deal with these data. And she deals with Ontario OHIP data.
Okay.
And so
Well,
she-
we have it linked for our
You do?
our parental benefits project, so I'll tell you about it later.
Thank you.
Yeah.
That would be wonderful. So family-related benefits, here's how I got to it, and maybe that was way too much of a roundabout way. But in order to identify spells of parental insurance, we developed 3 identification algorithms. So first of all, we used the Universal Child Care Benefit, which only unfortunately kicked in 2006. That one is a really sensitive indicator. So we really get it when we look at a change in UCCB. So what we're looking at is prior from T to T+1, whether there's been a change in UCCB because maybe they had a child before, so it's not from 0 to non-zero. And they had E-ins, employment insurance in T. We assume that employment insurance, we don't take into consideration that employment insurance spell because we code it as parental. Then we expand the lag a little bit, so we look back a year and that actually catches a little bit more, so employment insurance in T. And unfortunately, because UCCB is only 2006 and more, and we're doing 1993 to now, what we have to fall back upon is whenever there's an employment insurance receipt during the period that is bound by the age of the oldest to youngest child, we are removing it. So the results I'm showing you have this very stringent, probably overshooting criteria. But now in 2014, we actually have survey self-reports of parental leave until since the last survey, and of receipt of government income during the parental leave. And we're taking that, like EPI talk here, as the gold standard. So we're going to believe individuals when they tell us that they took a parental leave and take that as our measure. And taking that measure as like the perfect measure of whether they took a parental leave or not, we calculated the sensitivity and specificity of those algorithms. Right now, I'm not showing you the results, I'm being coy. They don't perform super well, I'm going to be frank about that. The reason being that it's 2014, so the survey was in 2014, the linked income tax data was in 2013, so the latest. So we're missing some income tax reports. So by the time in 2016, we'll actually have a good coverage of their income tax period. And I think by that time, so we do super well on the negative predictive validity, meaning we're not identifying pretty much anybody who is not a parent, but we would expect that because they're fewer than the others. But on the positive, we're not doing as well. But things are going to improve. And then further refinements, because Quebec is actually not participating in the same program, it has its own parental insurance program, we can actually test Quebec against the rest of Canada and see where things are playing out, but the numbers are getting small. These are slightly older people that we're talking about, so not that many kids. So those are like kind of point number 5 in using admin data. Sometimes, when I get to the final product of these papers, this is all going to be subsumed in a sentence, right? Maybe in an appendix somewhere. So if you get into, again, that administrative data wonderland, be mindful that there's great potential, but also some challenges down the road. So now you're all waiting for the data or the results. So that was an inroad into what actually goes, and you all graduate students know this. Sometimes you just, when you hit regress, then it makes very little, it belittles everything that went into that creation afterwards. So this is my sample selection. So all the respondents here have received some employment income in the past, and they have measurements for health and disability. I am controlling for mothers and fathers at level of education. Truth be told, part of my interest here was looking at this pathway that I hinted at earlier on the Lifecourse. Guess what? No effect. Nothing, like 0. Multiple specifications, even on from mothers and fathers level of education on the income variables, very low. So I have to explore that further. It may be, I'm looking at 40 to 64-year-old respondents. It may be that the effect has waned so much. There is some variation, so it's not a matter of variation, but there's just very, very little signal. And it like barely clocks in when I have the full sample. Whenever I split by gender, gone. So that was my surprise, but it's still in there as a control. Whether the respondent was born in Canada, definitely playing a role. Respondent living alone, family, sociology, demography people, major association, like robust to everything. And respondents' level of education, okay effect. Age is just a control because I do have a 20-year gap. Basic logistic regression is what I'm presenting you today, and I'm running out of time. And of course the usual Health Statistics Canada bootstrapping. So first, the family income trajectories. So these are latent class analyses of the whole 20-year period, and we ran them separately by sex. And for both, the fit is best with 4 classes. The idea there is that we started out our analyses looking at 5-year averages of income, and we wanted a measure that was a little bit more parsimonious, that summarized the experience of those respondents, because at this point I'm just using it as a control. So I want to control the level of income over that 20-year period. And so these 4 classes actually summarize that experience really well. So of course, you see here, so the women in blue and men in orange, and they look very similar, and that is in my assessment due to the fact that these are family, they're household measures. So if we looked at individual income, it would look very different, but just in the background for the analysis. And now, the crux of the analysis. This is essentially a descriptive variable looking over the 20-year period on whether respondents ever received income benefits / subsidies. Remember, here we're excluding, in the very large sense, those individuals that we think might be on parental leave. So those are all gone. So the differences that you're seeing here between men and women, where women are getting more unemployment than men, are as they're not coming from parental insurance, I think, as far as I can tell. What I will point to is the fact that disability, as you see, this is what I was hinting to, much more likely to come from men. So these are disability that I think are from physical jobs, and they're much more likely for people to be medically qualifying for disabilities. I also did look at the years, the number of years that people were in those various statuses. So disabled, that they had received disability, social assistance, and unemployment. And disability is very rarely more than 1 year. So these very specific disability receipts are not very common. The other thing here, so the largest group never received employment insurance, welfare, or disability. Then you see the next one is unemployment only, and then we have some variations of unemployment, disability, and welfare, and so on. I may actually have to collapse some of those because of small numbers. Welfare is a very small number. So due to the undercount, probably under coverage in surveys and both admin data, we're not getting very many people in that category. Disability here, again, unemployment and disability, disability only, you see more male. The other difference is women fall into those categories here. So looking now on at the association of the income trajectories, so these are the classes, with the reference being low income to poor health and disability. So I built the model sequentially, so first income, and then I add the types of incomes. You see in both cases that we have a nice gradient where higher incomes are associated with lower likelihood of both poor health and of disability. This is between 40 and 64-year-old, as a reminder. And you see the differences between men and women are not significant in this. The changes now when we add the ever received the benefits, so this is how those estimates of income change when we add let's say the composed variable that I showed you. So you see now that there are some categories in the mid-low particularly that are no longer as significantly different as with the, and these are the same samples over the same sample size over the same group. So there's a little bit more of the pulling out. So the addition of those categories of income trajectories actually makes a difference to those models, significant likelihood ratio test here. Now, the models themselves. So this is poor health, and here you see on this axis the various categories, and here no receipt of benefit ever is the reference category. And what I'll want you to focus your attention on is that here, employment insurance only, not significantly different. But it's not a matter of power. First of all, it's the second largest category. And second of all, you see that even with those smaller categories here, yes, the confidence intervals get much larger, but we also see, I arrayed it in a gradient, just so that we could see where things are coming from. But you see that there are differences that are coming in. So unemployment only, relative to never having been unemployed, no significant difference. And this is back to my question, right? Heterogeneity. So when it's only that, it looks like, they look like the rest of the population that never received benefits. Whenever we bring in any of those other benefits, I would suggest that they act as a little bit of canary in the gold mine. So is it unemployment first, that is then followed by welfare, or disability first, employment, and welfare, how they play out? We're working on establishing the temporal order of those now. And then looking at disability, you see a similar picture, a little bit more movement as far as men and women are concerned. So that's not entirely surprising. So again, you see employment insurance not being, only unemployment insurance not being significantly different from never having received benefits, and then movement elsewhere. final slides on with data, I just wanted to look, actually I'll get to men a little bit easier to see the same relationships, men and women. I just had a little last worry that maybe the people who never received any benefits are those unobserved people. Maybe they should have qualified for uninsurance, they should have qualified for disability, but they never got to it. So maybe it's a big mix of people, and actually maybe they're the most deprived people. They could be the most welfare deprived people. But so I cross-tabulated our income categories. So these are the income trajectories. Now I had to aggregate middle, high, and high because of small cells. Because if you're working in the lab, no. And so I looked here, and so you see here, never received UI, welfare, or disability, and you see that it's the category that actually has the largest proportion of individuals with high income, middle, high, and high income, and the lowest category with low income. And so in that sense, I am more confident that this is not a group, at least for their income history, this is not a group that is deprived. So whether they could have qualified and didn't claim it, that's another story. But somehow they managed to keep relatively high income, which is not the case when you look at welfare only or welfare and disability. And here, look, this last little bit that I was mentioning about disability. So I think this is really interesting. They look the most like the people who never received benefits. So that's what I was hinting to when I said that so far as these are people who claimed disability benefits. So there is something with claiming disability benefits that these are, and presumably they might recover from this. So either they started out with higher incomes and continued with higher incomes. Yes.
Amélie, you have unpacked them unpack the heterogeneity in terms of income, but what happens when you look at other characteristics like education, marital status, how do they compare? Are they still the same, the disability and the number of
Next steps, I promise. I haven't done it. I just started with income, or I was most concerned with income actually, as a big kind of predictor as far as this model was concerned. So to conclude then, I hope to have convinced you that a history of income benefits is associated with health in older adults. And this is net of historical levels of income, historical categories. And specifically, this is a story about null finding. But I think one that is pretty telling. So those with only unemployment insurance are not different from those who never received any other benefits. All other combinations of benefits are associated with a higher likelihood of poor health and disability. And so my interpretation of this is that it is proof of the heterogeneity that exists between the association between unemployment income here, of course. So I will end on that in saying that I'm not looking at job loss. I don't have these data. I don't know whether they lost their job and got unemployment insurance. I only know they got unemployment insurance. The next step is to look at job loss. And so this reflects strong selective processes that are just only starting to be unpacked, at least in the North American context. And so, heads up, more linkages coming up. So I'm overlaying here there is still the LISA, but now I've added the NPHS, National Population Health Survey, is currently in pilot mode. The linkage has been performed with the SDLE. My team is working on it for analytic purposes, analytic testing for Statistics Canada. They keep telling me that it's going to roll out in the RDCs soon. They're still working out some kinks, so they got hung up in the Health Analysis Division because they reperformed, so the NPHS was always linked to the mortality records going forward. They performed an overlay of another record with mortality on the NPHS, and they found some discrepancies, and that stopped them in their tracks. They looked into it, so some people actually reported that the respondent was dead. when they weren't. They really didn't want to report that they didn't want to answer that survey anymore. And so the linkages were discrepant on some very few cases. But that stopped them for a little while, and now they're picking it back up. So NPHS, the advantages, this is a survey. And so we do have information like job loss. And it's going to be overlaid or linked with the TIF. It is linked with the TIF. So in those analyses, which I'm not allowed to release at this point, we can actually look at this interplay of poor health, poor self-rated health, perhaps leading into job loss, perhaps leading into unemployment, and vice versa. So I'll stop on that. I thank you for your attention. Sorry for going long.